Hello viewers, welcome to Fit Northeast. I am Darshana Bhuya with all of you. And as you all know, Fit Northeast is Northeast's first health and wellness news portal. And it's a pleasure to have, and today it's a pleasure that we have Dr. Vikash Bowry, who is a urologist. So come, let's chat with Dr. Bowry. Hello doctor. First of all, can we have your introduction please?
Myself, Dr. Vikash Bowry. I'm a consultant urologist in St. John's Hospital and also Nemcare Hospital. I have been practicing urology since last 10 years, and I have treated many patients of diseases related to urology, and I'm getting good feedback from my patients. Thank you.
Moving ahead towards our question answer session, my first question to doctor is, in which part of our urinary tract mostly stones are formed or stones occur?
The urinary system, as we know, comprises of the kidney, urinary ureter, and urinary bladder, and the urethra. So the most common location is the site where the stone is located is the kidneys. So the stone first start formation in the kidneys, most commonly, but it may start formation somewhere else also. But mostly the common site is the kidney formation stone, and then from the kidney it may come down to ureter, urinary bladder, and urethra. So I will say the stones we can find stone in any of these places along the urinary system.
Thank you so much, doctor, for answering my first question. The second question to you is, under some situation, we might have to hold our urine for a longer time, or we do it more often sometimes. What is the risk of holding urine for a long time?
We have seen this problem mostly with females, so that they hold the urine for longer times. So what problem does it cause is that it may cause to urinary tract infections. So if it continues, if we start to keep holding urine regularly, and though the urinary tract infections, they will also come now and then, means there will be recurrent UTIs. So this recurrent UTI is one of the most common causes of urinary stone formations.
Doctor, my next question is, what are the conditions under which a person might develop a urinary stone?
There are many causes of stone formation in a person. Not one specific cause lead to stone formation. So if a person, anyone from his family has got stone, so then there are increased chances of stone formation in other members. If a person has formed stones already, and then he may have recurrent stones, so the chances increases of recurrent stone disease. It is also very much related to the water intake of the patient, means of the person. If the water intake is very less, or usually he is dehydrated, or if like dietary factors are also there. So if the person takes lot of animal proteins, or if he takes a lot of salts and sugars, then the chances of increased stone formation are there. And also many diseases are also there which may lead to increased rate of stone formation, like hyperparathyroidism is there, like uric acid, that is hyperuric acid formation is there, and like gout patients may form stones. And if there is renal tubular acidosis, or hyperoxaluria is there, cystinuria is there, all these are conditions where stone formations may be there.
Doctor, what are the symptoms of kidney stones?
Usually a patient comes to us with pain, so that is the first most common symptom of stone disease. But the patient may not have any symptom if there are stones inside, so that is a dangerous thing, because until and unless the patient or the person doesn't have any symptom, he won't come to us. So the problem inside will be getting increased gradually. And other most common symptoms that the patient usually comes to us with nausea or vomiting along with pain, or there may be some blood in the urine, or there may be some lower urinary tract symptoms like urgency, frequency, or inability to pass urine also. And the stone may lead to infections. So if the patient presents late, so he may come to us with fever, or sometimes we have seen patients who come in shock also with stone formation, with stone patients. So these are the most common symptoms usually we get in stone disease.
Doctor, what are the procedures through which one can diagnose the stones?
The first and foremost investigation of choice in a patient who comes to us with pain abdomen, and if we are suspecting stone disease, is ultrasonography of the abdomen. So this is the initial diagnostic modality we use, and along with that it is supplemented with X-ray of the KUB region. So both these first line investigations are very useful to us. If this doesn't match with our clinical findings, then we go for non-contrast enhanced CT scan of the KUB region. So that is very sensitive in picking renal stone disease. And also the other procedures, like we have to go for if we diagnose stone, then we have to go for some other procedures like investigative procedures that which follows how we are going to treat the patient. So we may have to assess the renal functions, like we may have to do intravenous pyelography or CT scan pyelography also we can do. And other routine investigations which we must do in a patient with stone disease, like urine routine examination, and if whether the urine is infected or not, so we have to do a culture test of the urine, and other basic blood investigations, and renal function tests are very important. So these are the usual diagnostic procedures, and accordingly then we may proceed further that what other procedures may be required.
What are the treatments of kidney stones?
The treatment modality of kidney stone varies, because if a patient comes to us with acute pain, abdomen, nausea, vomiting and all, and he cannot stay with the pain, then the treatment varies, and investigation modality also varies. That kind of patient we usually go for a CT scan of the KUB region, and we see where is the stone located and what treatments can be given. The other treatment modalities, like if the stone is small stone, incidentally detected stone, some of them, and depending upon the location of the stone, where the stone is located, so the treatment varies accordingly. So if the stone is in the kidney, say less than 2 centimeter stone, and it is not causing much symptoms, also little pain is there, then we go for some extra investigations. And if we see that the kidney function is normal, everything fine, then we may go for extracorporeal shockwave lithotripsy. Also it varies with the size and the location of the stone in the kidneys. So there are different locations in the kidneys where the stone may vary, and according to size in the different locations, the treatment procedures may also vary. So the different procedures for kidney stones include extracorporeal shockwave lithotripsy, that is ESWL. In common language we say that stone to bahirar par bhangi diye, that is lithotripsy we say usually. So that procedure, the patient doesn't have to stay in the hospital, that is a daycare procedure. We usually do it regularly. Other procedure for kidney stones are percutaneous nephrolithotomy, that is called PCNL. That is usually in common language it is called keyhole surgery. আমি ফুটা কৰি পেলাই stone to উলিয়াই দিওঁ, that is keyhole surgery, it is PCNL. This patient has to stay in the hospital for at least 2 to 3 days. And other kidney stone procedure is RIRS, that is called retrograde intrarenal surgery, that we have to go with a flexible scope, that is scarless surgeries. There are no incision in the body, that's why it's called scarless surgery, and for that also the patient has to stay for 2 to 3 days. If the stone is located in the ureter, that is the stone has come down from the kidney and it is located in the ureter, it is causing much symptoms, and then we may have to remove the stones by endoscopic treatment, that is called ureteroscopic lithotripsy. So we are regularly doing these procedures. And if the stone is located in the bladder, urinary bladder, it has come there, it is causing urinary symptoms and all, then we may have to remove it endoscopically. So these are all scarless surgeries, that is called cystolithotripsy we usually do. So there are various procedures for the treatment of urinary stone disease, which depends on the size of the stone, how is the patient presenting to us, and also the site of the stone, where is the stone present. So accordingly we divide into various categories and treat the patients. All the procedures are regularly done by us, and 99% of the procedures are almost scarless procedures.
Thank you so much, doctor. My next question to you is, what is the importance of stone analysis?
Yeah, this is very important actually, stone analysis. So this stone analysis is usually done after the removal of the stone. The fragments which we get from the body of the patient, we give that sample for analysis of the stone, and we see the content of the stones. That is, it may be calcium or oxalate or phosphate or uric acid or any other content. What content is the stone made of? So the most important thing is that after looking at the contents, we may ask the patients to restrict some of the dietary factors. So accordingly, we may give some dietary advice. So there are so that the chances of the stone formation, again, that is recurrence of the stone, will decrease.
Doctor, my next question to you is, what are the long-term consequences of kidney stone?
So if the stones in the kidney or anywhere in the urinary tracts are treated in time, and if we get relieved, the patient is relieved of the stone, so the long-term consequences are very less or minimal, I say. There may be chances of recurrent stone, but the long-term bad effects are very less. But if the patient is not being treated for the stone, he has been diagnosed with stone, but he is not getting the treatment, then there may be recurrent urinary tract infections, which may lead to many symptoms like fever and all, chills and rigor is there, and ultimately the patient may lose his kidney. So if the recurrent urinary tract infections and that may lead to pyonephrosis formation, that is, pus will be formed inside the kidney, and ultimately he may lose his kidney. So we have got so many patients that we have to remove the kidneys because they didn't get the treatment in time, and they also neglected, some of the patients also neglected their symptoms and all. So they lose their kidney, one kidney. So that is a very big complication and long-term consequence. So we have to be very careful regarding this thing.
Thank you so much, doctor, for answering the questions. We have now almost come towards the end of our show. And my last question to you is, what are the chances of, decreasing the probability of stones?
Yeah, that is very important, so that if we can prevent some of the diseases, then it is very good for the public or the people. So first thing is, how can we decrease the chance of stone formation is, we should be hydrated adequately daily. So adequate amount of water intake should be there. That is around, for adults I will tell you, around 3 to 4 liters per day. And accordingly, if it is too hot, then we may have to increase, or if it is less hot or okay, then we may decrease a little bit. So adequate hydration is very important. Again, dietary factors are important. We have to decrease the intake of protein, that is, animal protein should be less. Again, we should have more of this citric acids, fruits like this thing in our diet, so that the chances of stone formation will be less. Again, we have to decrease intake of salts and sugars, so which we follow very commonly, rampantly in our diet, so that we are taking extra salt or extra sugar or anything. So at least we should decrease those two things. Salt and sugar restrictions will lead to very much decreased formation of stone disease. And also more oxalate content food like spinach, brinjal, and then pumpkins and all, and other vegetables which have high content, or any other food products having high oxalate content should also be restricted in our diet. If we follow these common procedures, then gradually our chances of stone formation will definitely decrease.
So friends, we have almost come to the end of our show. I hope all the advices and this chat with Dr. Bowry will definitely be beneficial for all of you. Before ending our show, let's hear the final words from Doctor.
Yeah, I would like to wish all the best, and also congratulate you all guys for starting this initiative, so that the common public will definitely be very much beneficial in prevention of disease, which should be our motto. Not only treatment, but how to prevent the disease is very important for us. Thank you.